Hello, my name is Dr. Philip Mease. I'm a rheumatologist based in Seattle, Washington. I direct the Rheumatology Research Division at Providence Swedish Medical Center here in Seattle and conduct clinical practice in rheumatology. So what Johnson & Johnson did was to say, well, this is really an important outcome measure, and the ability to inhibit structural damage is very important to patients, as I mentioned before, as well as clinicians. So they embarked on a very large trial, over 900 patients, and they were very careful about identifying patients who were more likely than not to have structural damage progression. So, for example, they made sure to include patients who had at least two erosions on their baseline films before they received the drug. These are people that are more likely to progress, and other factors as well, including elevation of an inflammation marker called CRP. So, with this patient group that had severe disease activity and was likely to progress. They then proceeded to test both every 4 week and every 8 week dosing. Every 8 weeks is consistent with the approved label for the treatment, for this particular treatment, versus placebo. The primary endpoint of the APEX study that this was called was an ACR20 response. So this is a clinical response, improvement of tender and swollen joints and patient global and patient pain and so on. And this showed a highly statistically significant improvement, meaning the ACR20 was achieved by the majority of patients. And it was similar to the results that we saw in the previous Discover 1 and 2 trials. The key endpoint, though, was the X-ray data. And here in this trial, both the every 8 week dose, the approved and dose for use in clinical practice, as well as the every 4 week dose, clearly showed statistical improvement compared to placebo, and the two dose arms are very similar to each other in this regard. So we were very pleased to see these results, and therefore, now that this is officially in the label, we can turn to our patients and let them know, hey, not only can we expect to have improvement of pain, fatigue, stiffness, better function, better quality of life, and so on, but we can also indicate to you that this drug has been proven to inhibit structural damage progression, and thus alleviating their concern about whether or not with this drug that they will have the capability of doing so. And when you pair that promise with the overall safety of this medication, which is really quite good. It's one of the safest medicines that we use in clinical practice. That's a biologic medication. I think that this is a real win for patients.